us and joining us in this webinar. It's a pleasure for me to speak to all of you about cardio-oncology and what we do in a cardiac clinic that looks after cancer patients. So let me see if this works. So before we dive into understanding what cardio-oncology is, let me tell you a little bit about myself, or actually a short story here. When I was a young medical student back in the year 2000s, cardiology books were already very thick. They had at least 1 or 2 volumes, but interestingly enough, the section dedicated to cancer-related heart disease was only at the most, I would say, 2 paragraphs. Let's fast forward 20 years from then, and we have now dedicated cardio-oncology textbooks. We have manuals, we have cardiology textbooks that dedicate chapters and subsections in cardio-oncology. We even have patient targeted or dedicated literature. These are leaflets from Macmillan Cancer Support that you can download from the website, and this is a very recently published cardio-oncology guideline that is for patients. Now, why has this happened? Why has there been such a dramatic increase in available resources about cardiology and cancer? And let me show you a few more numbers. It's not just the resources that have increased tremendously, it's also the number of patients referred to a cardio-oncology service. These are numbers from our service, the Cardio-Oncology Center of Excellence at the Royal Brompton Hospital, where we can see that the number of referrals and the number of total consultations have increased exponentially in the last 10 years. Well, why has this happened? I like to call this a story of success, and allow me the biased picture here, but 20 years ago, cancer treatments were quite limited. The truth is, it's quite sad, but patients who were diagnosed with metastatic disease or certain types of blood cancers, of lung cancer, they probably didn't survive very long. So what happened to the heart in a couple of years after the cancer treatment was not the main interest. The main focus of the treatment was to reduce or shrink the tumor size, improve the quality of life, which is very important. But obviously, there was not much interest in the long-term side effects of these treatments. Now, this has changed. And why has it changed? It has changed thanks to the revolution in cancer therapy. So this is why I call cardio-oncology a story of success, because thanks to success in the new therapies, so targeted therapies, immunotherapies, cellular therapies for cancer treatment, it has allowed patients to survive longer and longer, so long enough to be able to get cardiovascular disease in the long run, is that we now cannot overlook anymore the previously ignored cardiovascular side effects. So, as a result of this story of success, cancer medicine and cardiovascular medicine are now 2 medical worlds that have collided. And cardio-oncology is not getting any simpler. As we speak, there are new therapies available. It's hard enough for us, the cardiologists, to learn how to pronounce these new therapies, and they get another one in the market. And this is great news for patients. But there is a downside to this. And I would call it a downside or a trade-off, actually. It has to do with this. The fact is that cancer is a consequence of exaggerated cell division, increased cell numbers. Tumors are lots and lots and lots of cells all together, and they are fed by new vessels, so more blood flow into the tumor is needed, and increased metabolic activity. On the other hand, heart disease is a consequence of all the opposite, of failure in cell division, of low blood flow, of impaired or decreased energetic efficiency. So when we are treating cancer and trying to stop the progression or the growth of the tumor, we will inevitably have or affect the heart and the cardiovascular system. So this is why cardio-oncology exists nowadays. And what is cardio-oncology? Well, cardio-oncology is the subspecialty in heart medicine that is interested in preventing, early diagnosing, so detecting it early, and if needed, treating cardiac disease or cardiovascular disease that is as a consequence of cancer treatment. And it's not our own job, but it's our main job. And if we put it in simpler words, we can say that our job is to do everything that's in our power to allow you, the cancer patients, to receive the best cancer treatment available without the trade-off or with the lowest trade-off possible. What we don't want is to switch one disease for another. And what kind of toxicities are we talking about? Well, our next speaker will talk about heart failure. Heart failure is the weakening of the heart muscle, and this is the best understood cardiac toxicity, but it's not the only one. High blood pressure, blood clots in the arteries or the veins, chest pain, arrhythmias, inflammation. The spectrum is quite broad, and depending on what treatment you are receiving, what toxicity we will be expecting. So what can we do? As the medical team, we will monitor for any signs of heart problems. When? Before, during, and after your cancer treatment. But you, as the patient, we need you to report any heart symptoms to your medical team. Remember to take any heart drugs prescribed. So how do we monitor your heart? There are very simple tests, such as an electrocardiogram and blood tests. There are a little bit more complex tests, but harmless and painless, such as ultrasound of the heart, and some more complex, even more complex tests that are done only in specialized centers, such as cardiac magnetic resonance and cardiac computed tomography, that allow us to understand in depth what's going on with your heart. With all this information, so your medical history, the results of the tests, the type of cancer therapy that you will be receiving, we can calculate broadly, but we can also use specific calculators to calculate your risk of developing cardiac toxicity during your cancer treatment. And if you're considered low risk, then you will start cancer therapy without any further delays. Now, if on the contrary, you are categorized as high risk, then a referral to cardio-oncology might be very beneficial for yourself. What are the risk factors? So what are the factors that might contribute to increasing the toxicity? Because obviously not everybody has cardiac toxicity when receiving cancer treatment. Well, if you have a cardiac condition prior to being diagnosed with cancer, this will increase your possibility of having cardiac problems during your treatment. Then if cardiac condition runs in the family, also if you have some of what we call the classic or the traditional cardiovascular risk factors, such as high blood pressure, high cholesterol, diabetes, smoking, unhealthy diet habits, those all also contribute to the increased risk of toxicity. The results of the tests, and then if you've had a previous cardiotoxic cancer therapy. All of this sounds very bad, but there are things that you can do as a patient to reduce your own risk. So making healthy lifestyle choices, it sounds obvious, but watching your diet, trying to keep up with exercise, weight control, and smoking cessation is very important. This will reduce the risk of having to stop your treatment or interrupt it unnecessarily. working with your medical team to manage your cardiovascular risk factors. If you had been previously diagnosed with high blood pressure, diabetes, or high cholesterol, don't ignore these during your cancer treatment. They are as important. Taking your prescribed medications and discussing any new symptoms that you might have. Which are these new symptoms? So if you have palpitations, you'll feel your heart racing, you have chest pain, you notice your legs to be swollen, you are more fatigued or short of breath or dizzy than before. Don't worry, they might not directly mean that you are having a cardiac problem, but just let us know. That's your main job, to let us know, and we will do our job. So with this I close. This is my final slide. We know that this might be very challenging times if you're undergoing cancer treatment and you are told or diagnosed with a cardiac complication of your cancer treatment. Might be very challenging, but you should not be doing this alone. There are support lines from